Okay, so next we have the Davenport diagram. So before we go to that, let's go over this mnemonic. It's from Dr. Barone's videos. It's a good one. So this mnemonic is to quickly have us pick between a respiratory situation and a metabolic situation. Of course, this does not cover the mixed disorders, but yeah, it's a start. So what happens is the mnemonic is respiratory opposite, metabolic equal, or it also says same. So it has an M. If the arrows are in the same direction, then it's a metabolic. Whereas if they're in reverse or opposite direction, then it's a respiratory situation. So for this, we need the pH and the PCO2. If the pH and the PCO2 are high, it's metabolic situation. Or if the pH is low, as well as the PCO2 is low, which means they're both in the same direction, then again, it's a metabolic situation. So this is how we pick metabolic situation. Then the last name, whether it's alkalosis or acidosis, that we know from the pH. If the pH is high, then we know it's alkalosis. If the pH is low, which means it's less than 7.35, then it is acidosis. So this way we can quickly pick metabolic and versus respiratory. So again, metabolic direct, which means both arrows will go in the opposite direction. Arrows for what? The pH and the PCO2. Respiratory, they'll be in reverse. One will be up, one will be down. So we know it's a respiratory situation. So again, for example, if the pH is high, but the PCO2 is low, opposite direction, so we know this is a respiratory situation. Or if the pH is low and the PCO2 is high, again, we know this is a respiratory situation. How do you know if it's alkalosis or acidosis, which is the last name? We know from the pH. The pH is high, which means it's more than 7.45, then we know it is alkalosis. If the pH is less, which means it's less than 7.35, then we know it's respiratory, and then we know it's acidosis. So that way we're able to find quickly respiratory alkalosis, respiratory acidosis, and so on. So having said that, this doesn't cover the mixed disorders, but it's a good start. The mixed disorders is usually, for the sake of step 1 questions, as we said, it's going to be for metabolic acidosis situation. So there we will calculate the Winter's formula and proceed from there. So yeah, so having said that, next we have the Davenport diagram. So this is just a graph to plot and visualize quickly what's going on, apparently to make it easy, but that's what Davenport did. So we have the graph and let's see what are we plotting. First of all, on the x-axis, we have the pH, right? And then on the y-axis, we have HCO3, number 2. And the third thing is this isobar. It's called an isobar, which is the PCO2. Isobar means equal pressure. So at any point on this curve, the PCO2 is going to be same, which means 40 millimeters of mercury. If this curve goes up, which means the PCO2 is increasing, for example, from 40 it went to 50, 60, 70, and so on. If the bar went down, which means the PCO2 is going down. So in this example, red line was 30, then it'll be 20 and 10 and so on. So they might give us multiple black and white lines on NBME, but this is what it is. So first to start off, now we know, okay, what is x-axis? pH. What is y-axis? Bicarb. What is the isobar? Normal PCO2. So this point of intersection in the midline is where all the normal values reside. So if you see here, this is corresponding to a pH of 7.4. This is corresponding to a bicarb of 24. And this is corresponding to a PCO2 of 40. So from this point, if the plot moves, that helps us diagnose the situation. So we need to remember what's on top and bottom. So if we go left, we know it's acidosis because 7.4, 3, 7.2, 7.1, and so on. So this is going towards an acidosis. If we look right, that means pH is increasing, 7.5, 7.6, 7.7, and so on. So this is an alkalosis. Okay, and then we look at bicarb, is it going higher, and so on, and PCO2. If it's anywhere on the same point, PCO2 is still going to be 40. But if the curve goes higher, that means this is higher PCO2, this is lower PCO2. And so this quadrant, if anything falls in this quadrant, The shaded area, we know it's respiratory acidosis. This little box, blue, is metabolic alkalosis. This orangish area is metabolic acidosis. And this is respiratory alkalosis. So let's break it down. So starting with this side. So if the pH goes down, we know it's acidosis. This is acidosis here, here, or here. Now, why is this metabolic acidosis? So let's see. Let's say we take a point over here. Okay. So here the pH is less. Let me mark this point. So if you talk about this point here, the pH in this point is about 7. So this is going to be acidosis. pH is less. Then let's say bicarb, what happens? So this is bicarb is on the y-axis. So here the bicarb is, in my assumed situation, bicarb is very less. Bicarb is around 5. So anything between 5 and going up to 24, right? So anything between 5 and 24 is going to be less bicarb. So this point is corresponding to lesser bicarb. Then what about the PCO2? Normal PCO2 we said was this isobar 40. Now this point has gone down. So we have to draw an imaginary line that this means the PCO2 has dropped. It's less than 40. So that's how we'll reverse learn, right? In the question, they'll give us a point. We'll not have the markings of what is what quadrant. So they'll say at this point, what's the condition? So now we know this is acidosis, right? We know the pH and the PCO2 both are in the same, both are less. So if both are less, then we know it is metabolic. So even if you don't use a mnemonic, we know that if this pH is less, it's acidosis. And why is it metabolic? Because the bicarb is going down. Metabolic acidosis because the bicarb is going down. So acidosis, either there's more production of acid or the bicarb levels went down. So this is a metabolic acidosis and on this point. And as we said earlier, the compensation will always be opposite. So if it's a metabolic problem, there'll be respiratory compensation and that will be immediate. So if it's metabolic acidosis, pH is less, PCO2 is less, bicarb is less. So the compensation will be immediate, which is hyperventilation. Why? Because now we have too much acid in the body. So we want to blow it off. So we hyperventilate to try to reduce the PCO2. So that's what it is. Okay. So yeah, this was the equation, right? So normally in our body, CO2 combines with H2O to form carbonic acid H2CO3, which dissociates readily or easily into HCO3 and H+. So if we have too much H+ going on, acidosis, we don't want more acid production, right? So we try to blow off the CO2 so that there's no more acid production. The reaction will not go this way if there's no CO2. Or an easy way, what I understand, that helps me personally is just think of CO2 as an acidic substance. That's it. So if we have acidosis, we want to blow off CO2 because it's acidic. We don't want more of it. This is just, it's not a scientific fact. It's just for helping me remember. PCO2 is like acid, right? So what happens if you already have acid, you have an acidosis diagnosis, we don't want acid in the body. So we will blow off the PCO2, which we're by indirectly blowing off the acid so that we can reduce the acidosis. So how do we do that? We hyperventilate and blow off this excess acid. So that was all about metabolic acidosis at this point. Next we have, let's say we look at a point over here. Okay, let's say now we're looking at a point over here. So let's follow this. What's happening here? Over here, we're still to the left. So pH is acidic, right? If you trace this down, it's around 7. So pH is less than 7.35. So this is acidosis. So last name done. Now first name, what is the bicarb level over here? This is around 35. What's the PCO2 level here? PCO2, this is isobar normal. It went up, which means the PCO2 went up. So if we know pH is down and the PCO2 is up. So pH is down, PCO2 is up, which means they're in opposite direction. So the mnemonic quick way, this is a respiratory situation. Last name acidosis because pH is less. So this diagnosis, this is a respiratory acidosis, right? Okay, now if you're not using the mnemonic, you just think about it also. So we know it's acidosis. Bicarb has increased from 24 to 35 almost, because at this point it's 35, right? And PCO2 also went up. So what could be the reason? We are building PCO2. So the patient is not able to blow off the carbon dioxide as it should. So they're accumulating the carbon dioxide. So the kidney is trying to retain the bicarb to compensate for this extra acid in the body. So respiratory acidosis, the pink box. So again, if the point is here, we're talking about respiratory acidosis. Best example is like an opioid. So what happens? The central respiratory suppression. So opiate is suppressing the respiratory center. Patient is not breathing. So what happens? You accumulate carbon dioxide. Once we accumulate carbon dioxide, it's like an acidic substance. So pH will drop. That is a respiratory cause of an acidosis. So what will be the compensation? If it's a respiratory problem, the compensation will be metabolic. The compensation will be by the kidney. Kidney will try to retain the bicarb, and that's why the bicarb is higher. So this will be, all of this will be the compensation. But yeah, if we talk about this point, the compensation will be the kidney will try to increase the bicarb resorption to try to balance off this acid. Okay, so that's respiratory acidosis. pH is less, so it's acidosis. PCO2 is high, so it's respiratory. And if, yeah, how is it respiratory? Quick way, arrows are opposite in direction. So it's a respiratory acidosis. Okay, so now let's say we're taking a point over here. So quickly, if you just visually remember, we know that this is falling in the metabolic alkalosis. Okay, right? So that way you can also answer. But in NBME, they'll try to give you multiple curves without any quadrants, and they try to confuse. So let's see. So if they say this is a normal curve, then we know that the PCO2 has gone up. First thing we notice. Now, actually, first thing to notice is the pH. What happens? pH over here, if we correspond to this point, it's around 7.55 something. So it's above 7.5. So we know this is an alkalosis. So we have the last name, alkalosis. Next thing, what happened to the PCO2? This also has gone from the isobar to this point. So from 40, it's gone to the next curve. So we know pH is high. In this example, in the case of my curve, it's, let's say, 50. So PCO2 is high, which means it is 50. So if both arrows of pH and PCO2 are in the same direction, then we know it's a metabolic condition. So metabolic alkalosis. So we have a quick diagnosis. Again, if we think about it, pH is high. What's the bicarb level for this point? It's approximately 40, 45 plus, almost hitting 50. PCO2 is high. So what could this be? Metabolic alkalosis. Either the patient is gaining alkali or they're losing acid. So easy example here is vomiting. If you lose acid while vomiting, what happens? Proportionally, the alkali of the body will go up. So that is an alkalosis situation. And this is a metabolic problem because it's nothing to do with the lungs. It's a metabolism problem. So if it's a metabolic problem, what's the compensation? Is going to be a respiratory compensation. So you have a lot of alkali in the body. What will be the lungs compensatory mechanism? They will try to retain the acid. As we said, acidic means carbon dioxide. So we try to retain the PCO2. So that's why the PCO2 went up. It went from 40 and it's going up to 50 in this example. So yeah, main problem was loss of acid, as in vomiting, or proportionally increase in bicarb. So if we're increasing the bicarb, what happens? The pH will become alkaline. So this is a metabolic problem because PCO2 and pH are in the same direction. So if it's a metabolic problem, what's the compensation? Respiratory compensation. PCO2 will go up, which means if it's a metabolic alkalosis, as in this case, compensation will be hypoventilation. Why are we hypoventilating? So that we retain the acidic compound PCO2. If we retain PCO2, what happens? If we retain carbon dioxide, what happens? This carbon dioxide will become so high that it shifts the direction of the reaction towards right, because the body is trying to drive more acid production. But easy way, this is more confusing. It can tend to be confusing. So if it's an alkalosis, first of all, if it's a metabolic problem, compensation will be by the lungs. If it's a respiratory problem, compensation will be by the kidney. Okay. So here we were talking about metabolic alkalosis in this point, as in the case of example, classic example, vomiting. If we have a metabolic alkalosis, compensation will be by the lungs by hypoventilating so that we can accumulate the PCO2. So we said shortcut, just remember PCO2 is like acid. So this acid is trying to increase so that it can cancel out the alkali. So that's the compensation. So we finished these three quadrants. Next, we have this lower quadrant, right? So let's say, now for my example, we're talking about a point over here. So now let's think about it. What happens here? Last name. pH is high. pH is high. So last name, alkalosis. Then what happens to the PCO2? From a normal isobar of 40, this PCO2 has dropped to, let's say, 30. Let's say in my example, less than 30. So this be, let's say, for example, 20 or whatever. So what happens? PCO2 is less than 40. pH is high. So pH is high. PCO2 is less than 40. So what happens? This is opposite arrows. So what is our first name? Respiratory problem. Last name we already got from the pH. pH is, for this point, is 7.6. So that's an alkalosis situation. Now, is it respiratory or metabolic? How do we know? pH is high. Okay. PCO2 is low. So opposite direction, always respiratory. So this is just a quick way if you don't want to think about it in detail. But let's say it doesn't help you, then let's think about it. So what happens at this point is pH is 7.6. It's increased. What's the bicarb level for this one corresponding to this point? If we trace it backwards, this is around between 10 and 15. Let's say it's around 12 something. So bicarb will be less. What happens to the PCO2? PCO2 has dropped from the isobar to this point. So PCO2 went down. So why is it alkalosis? Either we are losing acid or we are gaining alkali. So what could be a situation here? If it's a respiratory problem, something to do with the lungs. Okay, so respiratory alkalosis, classic example is, let's say, panic attack. Patient is having a panic attack. So because they're panicking about a situation, they are going to hyperventilate. When they hyperventilate, what happens? We are breathing off or blowing off all the CO2. So CO2 is dropping from 40 down to this point, which is less than 30. Let's say in my case, it is 25. So PCO2 dropped. So if the PCO2 drop means what? We're losing the acid in the body. So proportionally, the alkali will go up. So as we said, the alkali, no, one more time, sorry. Okay, so let's say we have a respiratory alkalosis again. What happened at this point? pH is high, 7.6. What's the PCO2? That also went down. What's the bicarb over here is around between 10 and 15. Let's say it's 12. So this is a respiratory alkalosis. So yeah, we have the quick way down. But if you think about the situation, what happens? Let's say the scenario was patient was having a panic attack. If the patient is having a panic attack, what happens? They blow off so much carbon dioxide that it drops. If the carbon dioxide drops, it's going to be what? pH will go up. We lose the acid proportionally, so pH is going up. Carbon dioxide has dropped. So this is a lung-related issue, so it's a respiratory problem. What will be the compensation? Kidney will compensate. How does it compensate? Since we have alkalosis, we don't want more alkali, right? So the kidney will decrease the bicarb. So in this situation, it is decreased. Again, my example, the bicarb has decreased from 24, which is a normal value at this point. It's come down to about 12. So that's respiratory alkalosis. It's for this point. But anything on this point will be a respiratory alkalosis. So we finished the 4 quadrants. So anything that falls between is a mixture of metabolic alkalosis and respiratory alkalosis. Anything falling in this quadrant is a mixture of respiratory acidosis and metabolic acidosis. So we saw in UWorld, right? Then example is patient is having a metabolic acidosis, a primary metabolic acidosis. So what will be the compensation by the lungs? But what happens is with time, the patient becomes fatigued and they have respiratory muscle fatigue. The diaphragm is weak or whatever. For some reason, they are now the respiration also cannot happen properly because the muscles are fatigued from trying to compensate. So this has created a primary respiratory acidosis. If the patient's respiratory muscles are weak, they cannot breathe properly. So they start retaining carbon dioxide. Both the cases will be there. So what happens is there will be a mixed acidosis. I think you all have only seen mixed acidosis situation. I don't remember seeing a mixed alkalosis situation. But now we know if it falls in this quadrant, then it's a mixed alkalosis. And if it falls in this triangle, it'll be a mixed acidosis. So yeah, one more time, if it's a metabolic acidosis, pH will be less. PCO2 would have been lesser than 40. What happens to the bicarb? It's going to be between 24 and 5. So this is the range for the bicarb. So this is metabolic acidosis. What happens to respiratory acidosis? Again, it's acidic because it's on the left side of the normal range. So this is acidosis. What happens to the bicarb? It's come from a normal value of 24, which is here. It's going up anywhere between 34-ish to 50-ish because this range is going to be the mixed problem. Between 10 and 34, if the bicarb is, that's going to be mixed acidosis. So this represents any point over here will represent respiratory acidosis. Metabolic alkalosis, any point over here will have, because it's alkalosis, pH is high, so that makes sense. Any point over here, the carbon dioxide is going to be higher. So yeah, pH is high, carbon dioxide is high. Bicarb, which has also increased from 24, which is a normal value, up to 45 to 50. So this triangle corresponds to metabolic alkalosis. Then this region corresponds to respiratory alkalosis. Why is it alkalosis? pH is more than 7.45. What's the range for the CO2? CO2 will be less than 40. What's the range for the bicarb over here? It will drop. So kidney is trying to lose the bicarb, so tries to compensate by decreasing the bicarb. resorption. So it's trying to lose the bicarb out of the body. So bicarb levels from 24, which is the normal, it's going to steadily decline from 24 to up to 15. So this corresponds to the bicarb. And so yeah, buffer line is over here, which means from normal it's going down. This whole point is compensation. Similarly, here this whole thing was a compensation for respiratory acidosis. So metabolic compensation is to try to increase the bicarb. So quick way, first things first, look at the pH, then look at the CO2, look at the direction of the arrows for pH and PCO2. And then once you found out if it's a respiratory or metabolic, then you know the compensation is going to be opposite. If it's a respiratory situation, compensation will be by the kidney. If it's a metabolic situation, compensation will be by the lungs. Yep. So based on this, if you do your own thought process, it should become much, much easier. Just put a point anywhere, see what corresponds, what the pH corresponds, what's the bicarb corresponding, what's the PCO2 corresponding. And that way you'll get to a diagnosis. But yeah, the more you practice, the more it gets easier and faster in questions. Or if they give you a situation, then you should be able to think, okay, the patient is breathing hard, so they're going to lose the carbon dioxide is going to drop. Or similarly, if the patient is vomiting, what happens? You lose acid. So because you're losing acid, proportionally, the blood will become alkaline. Anion gap, again here, there is a production of a anion, which is not the normal anions in the body. So for example, lactic acid is the easiest example to think about. So yeah, sodium is positively charged. So cations are positive. Anions are these negatively charged. Normal anion gap will be in these situations. So then hypoventilation, what happens? If the patient is not ventilating, it will build the CO2. Build CO2, we're building acid in the body. It's because of the lungs, so respiratory situation. So airway obstruction, acute lung disease, weakness of respiratory muscles, and so on. So hypoxemia, high altitude, what happens? Patient is, there's not enough oxygen in the inspired air at high altitude. So PiO2 is less. So patient will try to breathe harder, hyperventilate, so as to try to get more oxygen. So that's where it starts. So when the patient is breathing harder to try to get more oxygen, they also lose the carbon dioxide. So what happens? PCO2 will be dropping, and so on. So yeah, that is the Davenport diagram. So a key mnemonic, Rome, respiratory arrows will be opposite direction, metabolic, they'll be equal direction. What's the factors? pH and PCO2. Okay. And this was another thing I picked online. Not sure if it's high yield, but anyway. So if you see that the arrows are going away from the midpoint, which is, as we said, this will be the normal point. If they're going away, then we know that is a uncompensated situation. We know if it falls in this quadrant, it's respiratory acidosis. If it's here, then it's metabolic acidosis. It's metabolic alkalosis, respiratory alkalosis. If you see a point going away or the arrow going away, then it's a uncompensated. I think it was from a video on YouTube, if I'm not wrong. So here, if it goes and it's trying to come back to normal, but it's still not met the midpoint, so it's partially compensated. So the arrows are going away, but they have not completely come back to the normal pH. So they're trying to bring the pH to normal, right? That's the partially compensated situation, which is in most exam scenarios. Yeah, here also it's trying to bring the pH back to normal and so on. So that will be a compensated conditions. Perfectly compensated means what? Although there was an alteration, now the compensation has brought it back to the normal pH. So that will be a perfectly compensated, which I don't think we'll see on the questions. Okay, so that was the Davenport.